Let's talk about management of hypertension. I know you might be wondering how to manage your hypertension, but guys, before you go into management, you should make sure you confirm that you have hypertension. That's bringing me down back to the diagnosis. I noticed I spoke about diagnosis of hypertension if you watch my other video when I was explaining all you need to know about hypertension. And in that video I do the diagnosis of hypertension include using the spiral manometer curve, which is the major diagnosis which all medical professionals use today. Alright, it's a major diagnosis. They just put the cuff on your biceps area, and they use the reading and check for the blood pressure if it's there or not, and they will be watching the machine. Alright, now we're talking about the diagnosis. We can use that an alternative to that. We can use ECG, we can use EKG, we can use echo as well, echocardiogram. Alright, you can use that as well. Alright, so these diagnosis apparatus are there. Alright, so it depends which one you want to do. Alright, it's fine, anyone you use is still fine. It will still estimate, like ECG will be showing your heart rate, etc. Alright, including echo and etc. So it depends on you. Now, coming to the management, there are 4 management factors which I will be tackling. First of all, diet plays a role. If I tell you, you remember I told you in the other video, I was telling you that you have to manage your intake of sodium. Alright, you have to manage your diet. You should not eat anyhow. You should not pour too much sodium, because there are studies showing that it works, it increases blood pressure. So, cut your sodium. Try to eliminate it from your food. We can't do without sodium. It's important to decrease intake of sodium. And another thing I'll be talking about is exercise. Exercise, I know is a physiotherapy. You must mention that exercise is very vital for controlling your hypertension. So that is very essential. But I'll be planning exercise for how controlling your blood pressure, but not now. In this video I'll be just talking about the management. Exercise would help you, especially another factor, risk factor. I mentioned the risk factor in the other video. Another risk factor of hypertension, which is very common, is obesity. When you're fat, so it creates more chances of hypertension. So we have to do exercise to control that, so that you won't be at risk, right? You don't be at risk. Alright, so that is risk factor. Alright. Now the last point is medication on your treatment. Alright. Now what should we put in mind when it comes to medications of hypertension? There are a few medications I could remember, because I'm not from the pharmacy field. I just know the few ones I can remember. I remember those days when we were in the bachelors. We have to cram so that we have to pass the exam, right? Alpha blockers, beta blockers, calcium channel blockers, diuretics, the ACE inhibitors, and angiotensin, etc. So these medications are very essential for hypertension, but you should not take medicines without consulting your doctor, because all these medicines, especially when it comes to your heart, they act in a serious way, I will tell you, because I have no full knowledge about medicines. Alright, so but they act in a very mysterious way, so you should not take medicine without consulting a professional. Alright, so this is just a short video about the management. In my next video I will be talking about how to plan your exercise. Alright, and you can recommend to my other video where I was talking a good exercise principle for everyone. Alright, you can use the principle in planning your exercise too. Have a very nice day, guys.